Hi, dear participants. My name is Qiancheng Zhou, currently a master student at Karolinska Institute in Stockholm, Sweden, majoring in global health. I'm originally from Shenzhen, China, and I have a background in molecular biology as well as in social work. Today, I'm privileged to present my ongoing research for my master's thesis, Health-Related Risks for my Chinese migrant workers in Africa, a scoping review. The Chinese labor migration to Africa is by no means a new phenomenon. It can be traced back to the 17th or 18th century, when Chinese people worked in some of the African countries during their colonial period. The recent outward flow of migrant workers from China to Africa is relevant to the economic reforms in China in 1978 and further accelerated during the past 2 decades. You can see from the graph that the number of Chinese migrant workers in Africa peaked at around 263,215, and since then showed a flow of returning migrants. Note that these official statistics do not include occupations such as traders and shopkeepers. So regardless of the relatively large size and mobility of the population, and despite the global debate on Chinese investments in Africa, very limited data is available on the demographics of Chinese migrant workers in Africa, and neither is there any systematic research on their health and health determinants. This population has been somehow invisible. Therefore, this article is aimed to provide an overview of health-related risk factors of for Chinese migrant workers in Africa throughout their migration trajectory, and further identify the knowledge gaps about health determinants of this population. This research is based on a search in 7 different databases, which include articles in English and in Chinese. The identified risk factors are analyzed through a conceptual framework, indicating that first, health-related risks are changing throughout the phases of migration. Second, the health-related risks can be viewed as interactions of biological, psychological, and social risk factors. And third, cross-cutting factors act as determinants of health throughout the migration phases. After a search and screening of articles, a total of 57 articles are included for the analysis. From the graph on the right, we can see that most of the articles were published after the year 2010. This is consistent with the growing trend of labor migrants from China to Africa in recent years. Looking at the risk factors mentioned in the included articles, most of the articles addressed social or biological risk factors of the population. All of these risk factors may influence the health outcomes of the workers. Although the overall demographic data of the population is still not available, in this article I roughly cluster the population into 3 groups. First is the lower skilled and semi-skilled workers. They are the largest group in terms of the size of the population. They tend to have low socioeconomic status, are often employed in short-term contracts, and work in the mining and construction sectors. Second is the managers and business owners. Compared to the first group, they tend to have a higher education level and may stay in Africa for a long time. And the third is the females. The size of this population is very limited. Being underrepresented and potentially vulnerable, females are viewed and analyzed separately in this article. Now, to understand their experiences, let's follow their journey from the beginning. For most of these workers, their migration to Africa is not viewed as an entirely voluntary choice, but as a push-out by the sense of insecurity and pressure of surviving. For some, being employed by Chinese companies means a sense of predictability and security, that the employer is their sole caretaker during their stay in Africa, even though this sense of security may sometimes be an illusion. The healthy migrant effect is also seen among this population. A selection of and self-selection process of their physical and psychological preparedness plays a role before their departure to Africa. For some migrant workers, it is their first time taking a plane and are unfamiliar with the rules and regulations concerning international travel, and therefore they may fail to reach their destinations. One of the most famous or most infamous living regimes among some Chinese migrant workers in Africa is the compound or live at work regime. This living regime may have been introduced for multiple reasons, including to avoid crime and conflicts. Whether intentionally or not, applying this regime makes the workers more exposed to long working hours, delayed payment, and substandard logistics. Furthermore, this regime also restricts these workers from developing social bonds or intra-group solidarity, often accompanied by reciprocal racism between the expatriate and local communities. Other risks they face include lack of vector control and limited access to hygiene. This not only contributes to a higher risk of for infections, but also leads to psychological distress. Their separation from families and lack of social capital in Africa also generated stress and loneliness. Different psychological patterns can be seen among the population, but in general, a lack of security in the sense of foreigners can be seen. The living regime may also further intensify the dullness of their life and the alienation between the expatriate and local communities. Some of the research articles mentioned that possibly due to the low educational level, their overall health literacy is low, being mostly young males living monotonously for long periods. Their sexual attitudes are relatively open. This partly coincided with emerging influx of young Chinese female sex workers in some regions of Africa. Some of these sex workers are exposed to abuse, intimidation, and sexual exploitation from their pimps and clients. Eventually, many of these migrant workers choose to return to China rather than take roots in Africa. A raised concern about importing malaria in China is strongly related to this flow of returned migrants from Africa. A large majority of imported malaria cases in China were from male migrant workers who came back from malaria endemic areas of Africa. Those who are at risk of malaria infections may also receive misdiagnosis, maltreatment, either in the host country in Africa or in local hospitals after their return in China. To sum up, the population of Chinese migrant workers in Africa is a heterogeneous and evolving population. A lack of demographic data may push the population into the void of receiving quality healthcare and adequate social protections. Furthermore, the vulnerability and the risk factors they face may change throughout the migration phases. Some of the risk factors may have not been examined at all in these articles. For example, information after their return to China is completely limited to articles concerning malaria control. It is unknown if the population is able to gain respect and security after their return, and it is also unknown if they are able to reintegrate back into the communities they once belonged to. Thank you for listening. This research is not aimed to either heroize or demonize the presence of Chinese migrant workers in Africa. It is instead aimed to move beyond the ongoing focus of state interactions to discover heterogeneity of this under-researched population and examine the life experience of this invisible population. If you have any questions, please feel free to contact me. Thank you, and wish everyone has a nice time at the conference.